J. Wayne McFarland, who is a fellow of the Mayo Clinic and a pathologist, felt that it would be in the field of nutrition that some of our greatest strides in the prevention of disease will yet come. And we think that he's right. The more we look at the evidence, the more we see this to be the case. But we haven't talked about ophthalmology. See, this is really pretty broad. Look at the dose-dependent risk reduction between moderate meat eater, low meat eater, no meat but fish, vegetarian, and vegan, and the risk of cataracts. How many cataract surgeries do we do? Has it become almost kind of large production? I wouldn't be surprised if there isn't something of the order of 500,000 or 1 million cataract surgeries in the United States each year. So how about not deadly, but unpleasant dysmenorrhea? And as Dr. Pittier was saying, we see a change in sex hormone binding globulin. Oh, wow, I got it. And you can see that the increase is a good thing, and that's what we want. The reduction in dysmenorrhea and premenstrual symptoms. How about the reduction of the risk of pre-eclampsia? Look at the difference in rates between vegans and the general population. Or how about, and we were hoping to say one day do a whole talk on this, on chronic kidney disease. And yes, diabetes is pumping a lot of that, but vegans have a less pathogenic level of glomerular filtration rate. I almost was able to say it. Lower albuminuria than meat eaters. They're at much less risk of chronic kidney disease. And when you go to treat chronic kidney disease, these researchers thought it was the first choice in diabetic nephropathy and chronic renal failure. Lower vegan diet was shown to lower the phosphatemia and the fibroblast growth factor 23, which is important. So what about applications to nephrology? And here you can see that in patients with chronic kidney failure, which is becoming all too common, that a vegetarian diet was shown to slow the progression of chronic kidney disease and failure, renal failure. How about cholelithiasis? How many cholecystectomies do we do in the United States every year? Vegetarians have half the risk, okay? I think this is broad, the message we want to give, we think this is very broad applicability to your practice, and we hope to see even more research. And I want to take something very mundane. We were talking about billions before. Americans spend $1 billion in laxatives every year from a meat-centered, low-fat, fiber diet, okay? And, okay, it doesn't compare with a myocardial infarction, a case of constipation, but it's very unpleasant for the patient. And I think, and I agree with Dr. Pittier, fiber has got to be one of the most under-discussed nutrients out there today. When we talk to people at our grassroots level and we try to determine, and we ask about their diets, how much fiber is in your diet, we're amazed at how low it is, okay? Americans are spending $1 billion a year to go to the bathroom. We think some things in life really should be free. How about diverticular disease? We know how common that is in seniors. Vegetarians have a decreased risk of 27%, vegans 72%. You can see the effect of fiber. What is it? 2/3 of all American seniors have, over the age of 60, in the United States, have diverticulosis. And eventually, you know, one of those pouches, one of those diverticula will become inflamed and possibly infected, and you have a case of diverticulitis on your hand, and that is no fun for the patient, and it can be an acute situation for the physician to treat. Here's a really tough pathology. I think there's something just under 1 million people in the United States today with Crohn's disease. We know that people usually get it in the earlier part of life. A vegetarian diet in girls reduces the risk by 70% and in boys by 80%. And we know what a pain it is to treat Crohn's disease. This was a very well done study published in the Journal of Gastroenterology, a 2-year interventional study. They were able to gain remission at 100% at 1 year, 92% at 2 years. And that 92% is, according to the researchers, is a better efficacy than is shown by any medication, including the new biologics. And it's also a difficult disease to treat, assuming the insurance companies will pay for that. There's methotrexate, if they're lucky. The 5-aminosalicylic acid derivatives will help. But that's pretty good. That's pretty good. Well, we were talking about cancer before, and Dr. Swenson rightly pointed out the recognition of tobacco and as a carcinogen and what a difference that has made in medical practice. The World Health Organization has, a little bit less than a year ago, classified processed meat as a group 1 carcinogen in the same group as tobacco smoking and asbestos as a carcinogen to human beings. Well, we know what we did to the cigarette machines, and we know how we now no longer allow cigarette smoking in the hospital. Why is this served in the cafeteria? Why do we have to serve bacon? All right. Red meat is now classified as a group 2A, probably carcinogenic evidence. And the groupings are based by the World Health Organization based on the strength of evidence. So what's going on? Especially they're concerned about colon cancer, which brings me to my next slide. Red meat increases the risk of colon cancer by 20% per 100 gram. And what is that? A little over 3 ounces? Now, processed meat, 58% per 100 gram. Now, processed meat also includes hot dogs. And I got to tell you, as a New Yorker, as where I'm originally from, some people still think I have an accent. I don't know. I could go to a ball game at Shea Stadium, and I could do, in my pre-vegan days, 3 hot dogs in one afternoon. Okay? And so we really begin to wonder about this. And we all know, is it colon cancer the second most common cancer in the United States today for a non-smoking male and female? I don't know, but it's up there. I think it's pretty common. Well, you can see that a plant-based diet decreased the risk of colon cancer by 46%, and interestingly decreased the risk of rectal cancer by 73%. So wouldn't it be great if, along with making some progress about breast cancer and endometrial cancer and prostate cancer, we could also do something about colon cancer? And we've got some lab data on this. This is not just epidemiological associations. Vegetarians have lower levels of matrix metalloproteinases that are associated with colorectal cancer in a mechanistic way, so far as we understand. The degree of overexpression of some of the MMPs has been noted to correlate with the stage of the disease and the prognosis. So there's getting colon cancer, reducing your risk, but then what's the advancement of the colon cancer once you have it, and what kind of prognosis are we looking at? And so we just wanted to kind of broaden the discussion a little bit. The acid test, and I'm going kind of quick here because I know that we ran over time. They say the most nutritionally demanding situation in medicine is that of the burn patient. And so it was tested. Vegetarian diets on all the parameters that they could look at, biochemical parameters, status of wound healing, microbiological investigations, length of hospital stays, graft take, and everything else. The vegetarian diet stood up, even under those extreme circumstances, as the meat-centered diet. And we think that is kind of the acid test. These were on patients with burns over 10 to 50%, 10 to 50% over their body, and they were second and third degree thermal burns. Well, we'll just leave you with this. We know this was shown before. More than 75% of our healthcare budget is being taken up by these diseases. We think that the vegetarian diet has something to offer, and we just kind of want to broaden, and we left out even here with this broader perspective quite a bit. We think that the applicability in your practice is actually quite broad, whether it's on the large scale, as Dr. Malhotra pointed out, in reducing multiply resistant bacterial infections that are emerging from the farm, or whether it's in ophthalmology, and we would have gotten into macular degeneration if we had time, or many other pathologies. We think that this really broadly benefits your patients, and we hope that introducing some of this information to you will be helpful to you and your practice. And both as a vegetarian society and as your patients, we're depending upon you to know this, and we're depending upon you to integrate this into our care, because you're who we're turning to. If, as a vegetarian society, you are who we want to refer people to when they tell us that they have a health concern. But also, we ourselves are also your patients. So we encourage you in every way we can to integrate this into your practice, share it with your colleagues, and wish us good luck, because we're going to write Dr. Ryan again and ask him please to include this in the medical school training at the University of Washington. When we gave a lecture similar to what we could do in these slides that I showed you here to resident physicians at Tacoma General Hospital, and at the end we asked them, how many of you here wish this were part of your standard medical education? Every single hand went up. Every single resident said they wished this was part of their training. So we're going to keep on trying at the University of Washington School of Medicine. At the medical schools now, we're going to branch out into Oregon and ask them if we can get that done. That's the long-term solution. But the immediate effect is for you to include it in your practices. We have on vegetarianprescription.org all the research summaries we could possibly come up with on the different topics that you've seen presented here. We were very careful to very, very copiously document everything. We thank you all for coming here tonight. We thank you especially for staying a few minutes late. We're sorry we kept you. But thank you for supporting our campaign, and I wish you all good health and a good evening. Thank you very much.